Hello everyone, welcome to Sociology 245 Deviant Behavior. I am Dr. Dilsora Fozilova and I'm very happy to be here in your third week's first lecture. Today's lecture is on medicalization of deviance, psychiatry, an essential topic that explores how society has transformed certain behaviors and conditions into medical issues, often with profound social implications. This lecture will delve into the historical context, theories, and the impact of labeling and stigma associated with the medicalization of deviance. We will also examine cultural perceptions and the inequalities that arise from this process. By understanding these dynamics, we can better grasp how psychiatry has played a role in defining and controlling deviant behavior. We will discuss the main theories, including labeling theory and also stigma, which posits that deviance is not inherent in an act, but is instead the result of society's labels. The role of stigma in perpetuating social exclusion and discrimination against those labeled as mentally ill will also be a critical part of our discussion. As we move forward, we will examine the cultural I can't talk today, cultural variations in perceiving and treating mental illness, highlighting how different societies define and respond to deviance. These cultural norms and values significantly influence the classification and treatment of mental illness, often reflecting broader societal inequalities. By analyzing these aspects, we can better understand the intersectionality of race, gender, and class in the experience of mental illness and deviance. Our goal is to critically assess the implications of medicalization of deviance and to consider how we might advocate for more equitable and compassionate approaches in psychiatry and mental health care. One of your readings is about the yellow wallpaper. I think that is shows in the history how mental illness was actually defined as abnormal, and then how that was treated. The woman in the yellow wallpaper was basically locked in a room with this very sickening wallpaper, and she couldn't do anything. She couldn't touch any pen, paper. She couldn't go outside. She couldn't see her child. So that is social construction. That's what we're going to analyze today. So I will share with you my PowerPoint, and we will continue together discussing the rest of the topic. So deviant behavior, third week, first lecture, medicalization of deviance and psychiatry. So mental illness and deviance are social construction. How it is social construction? Illness, like mental illness or many other illnesses, and deviance are often influenced by societal or cultural norms, factors that shape our beliefs, attitudes, and values regarding this stuff. And stigmatization and discrimination can arise from the misconceptions, fear, or lack of understanding about specific illnesses and conditions. If you remember in the beginning of COVID-19, we didn't understand the virus very well, and people started to act in certain ways. There was huge labeling and stigmatization of the people who were, that became ill of COVID, or there was kind of staying away from people. There was a lot of labeling and stigma was going around at that time. And this abnormality wasn't always the same. It always changed. In the history, it was different. People viewed, and according to their culture, according to how they, what their beliefs were, how they felt about certain illnesses. Abnormality can be defined as a deviation from the ideal mental health. So then we need to understand what is ideal mental health, right? Instead of defining what is abnormal, psychologists or sociologists define what is normal, ideal mental health. And anything that deviates from this is regarded as abnormal. This is similar to social norms. For example, we create a social norm that is whole society knows that's the norm. Whoever deviates from that norm is considered as deviant. For example, there is from blonde to very dark black. There is a norm. The hair color is norm in society. If somebody has blue or green hair, or paint their hair to blue or green, that would be abnormal. So when it comes to mental health, it is first of all not easy to define what perfect mental health is. So if we cannot define what perfect or ideal mental health is, how can we define what is abnormal, right? How do we know this norm is violated? How do we know this is abnormal? That is a very good question. Historical context. Let's dig into the historical part of how how deviance in mental health was viewed from the history, so we can compare with our time. In our time, we will consider these two questions. How has the perception of mental illness as deviance evolved over time in different societies? What historical events or shifts have contributed to changes in the societal understanding of mental illness? So, if we think about ancient or medieval period, we can think how we can kind of imagine how people viewed mental illness. In ancient societies, mental illness was often attributed to supernatural causes such as demonic possessions or divine punishments. People were like, oh, something demon got into that person and they are just acting up or doing something wrong, right? Medieval Europe saw the establishment of asylum where those deemed to mentally ill were isolated from society. There is a one book by Foucault that is about mental illness. It's a very interesting book. He talks about madness in society. It's something to consider actually to read. They um, they kind of looked into this mental health and they were defining the deviance according to that. And then in Enlightenment and early modern period, there was an introduction of more scientific approaches to understanding mental illness, viewing it as medical issue rather than moral failing. Early modern Europe began to develop institutions focused on the treatment and care of mental ill through often under harsh conditions. For example, in that Foucault's Madness and Civilization, he talks about that people being locked up in certain rooms and then how they act up. They were considered as like a madman and they were defined or kind of viewed as somebody gets very hot and they cannot be normal. There was all kinds of definitions when it comes to mental illnesses. In the 20th centuries, the rise of psychiatry centered the marked a shift towards medicalizing mental illness, though the stigma of deviance persisted. The 20th century saw significant reform in mental health care, including the deinstitutionalization movement, which allowed people to stay home or be with their loved ones. That was healthier environment for them, which aimed to integrate individuals with mental illness into the community. In today's contemporary views, there is a growing recognition of mental illness as a health issue, with an emphasis on rights and integration. Despite progress, stigma and perceptions of deviance still exist, influenced by cultural, social, and economic factors. So, the Enlightenment period brought a focus on reason of science, leading to more medicalized understanding of mental illnesses. Advanced in psychology and psychiatry in 19th and 20th centuries furthered the scientific approaches and treatment. The institutionalization movement was one of the things happened in the mid 20th century. This movement sought to close large psychiatric hospitals and provide community based care, shifting perceptions of mental illness from deviance to health conditions. And the civil rights movement too. Civil rights movement in the 1960s and the disability rights movement in the 1970s and 80s advocated for the rights of individuals with mental illness, promoting a view of mental illness as a condition deserving of support and integration rather than punishment. So, the development of widespread use of psychiatric medications in the mid 20th century changed the landscape of mental health treatment, making outpatient care more feasible and reducing the need for long-term institutionalization. The institutionalization was basically like incarcerating mentally ill people. It just had a lot of criticism, and that's when in the mid 20th centuries actually that started to change. And also the efforts by global health organizations such as World Health Organization, which is WHO, to address mental health as public health issue have contributed to broader understanding and destigmatization of mental illness. And also there was a media advocacy for mental illnesses. It increased over time as media became like a social media became very popular in our time. The media coverage and advocacy but by individuals and organizations have helped raise awareness and reduce stigma associated with mental illness, promoting a more compassionate and informed societal views. So, what are the sociological theories that explain this to this mental illness and deviance and the relationship between mental illness and deviance? So let's think about how do various sociological theories such as labeling theory and structural functionalism explain the classification of mental illness as deviant behavior. And also, in what ways do these theories account for stigmatization of mental health? So, one of the theories we talk is Structural functionalism. Structural functionalism, in our first class, I think I explained, or I gave a little bit of background on sociological theories, and I told you that they will play a role of as a fundamental part of our class, and we will build on them as we study the relationship between deviance and society. So structural functionalism, that founded or started by Durkheim, as you remember. And to remind you, it views society as there are institutions, social institutions, or social structures, and they have their functions like a human organism, right? We have heart, we have liver, we have brain, and then society, Durkheim says, is the same thing. We have um, healthcare system, we have religion, we have media, we have education, we have family. All of those are the social structures, and they function. They have their own functions, they have their own structures. They socialize, or there is um, socialization process that makes them um, um, let's say, get into relationship with one another and make this societal structure working together. So you don't have to do anything for these structures to work, right? So when it comes to explaining explaining deviance and mental health, we can talk about structural functionalism, viewing society as a complex system whose parts work together to promote stability. So, deviance, including mental illness, is seen as a threat to social order. Institutions like family, education, and the medical system function to identify and manage deviance, including mental illness, to maintain social equilibrium. Deviance, including mental illness, can serve important functions by defining social norms. If you remember, Durkheim says whatever is in society, it has a function, it has a place for it. For example, crime. According to Durkheim, crime also has its function in society. So all these functions, important functions, by defining social norms, promoting social change, and reinforcing societal values through the reaction and deviance. So, labeling theory. So, what ways do theories account for stigmatization of mental illness? Um, there is two main parts. One of them is stigmatization, and the other one is social control. And we can think of what are the social mechanisms that lead to the stigmatization of individuals with mental illness. So, and the second one is, how does stigma impact the lives of those labeled as mentally ill? The social control part, how do institutions like medical community, the legal system, and the media contributed to the social control of individuals with mental illnesses? Also, we will consider that what are the implications of defining mental illness as a form of deviance for public policy and mental care. So let's start with stigma. What is stigma? So, societal norms often dictate what is considered acceptable behavior. Deviations from those norms or acceptable behaviors, such as those exhibited by individuals with mental illness, can lead to stigmatization. Media portrayals and public discourse can reinforce stereotypes about mental illness, such as the notion that mentally ill individuals are dangerous or unpredictable. The process of labeling individuals as mental ill can result in being treated differently by society, contributing to sense of otherness or reinforcing stigma. We just talked about socialization, that there are institutions, and the institutions always interact with one another, and there is a socialization between them, makes this whole social structure, right? People learn from young age to conform to societal expectations, and deviations are often met with the negative reactions, leading to stigmatization. Policies and practices within institutions like healthcare, education, employment, economy can perpetuate stigma through discrimination, or practices like they are discriminatory and exclusion. So, how does stigma impact the lives of those labeled as mentally ill? So, stigmatized individuals often face social rejection and isolation, which can exacerbate their mental health conditions. Stigma can lead to discrimination in various areas, including employment, education, housing. It can limit economic opportunities and social mobility. Also, individuals may internalize societal stigma, leading to feelings of shame and low self esteem, which can hinder recovery and personal development. Stigma can discourage individuals from seeking help or fully engaging in treatment, negatively impacting their health outcomes. Stigma can strain relationships with family and friends, reducing the support networks that are crucial for coping and recovery. How about social control? How can we connect this social control, social norms, and whoever deviating from social norms controlled by society? We mentioned that in our other classes. So, how this affecting mental illness as deviance? Through the diagnosis processes and treatment protocols, the medical community can label and control individuals, often emphasizing medicalization and institutionalization over holistic approaches. Legal system, for example, laws and policies can criminalize behavior associated with mental illness, leading to incarceration rather than treatment. Mental health courts and compulsory treatment orders or examples of legal control and mechanisms. As I mentioned Foucault's book about madness and civilization, and also he writes about the psychiatry as well, because his own experiences, he observed how people can become um, controlled by certain people, in this case, psychiatrists, and they lose all of their rights. They can't vote, they cannot decide for themselves what kind of medication they want and what kind of medication they don't want. So that is controlled by healthcare services. Also, the media often perpetuates negative stereotypes and that cases involving mental illness shaping public perception and reinforcing stigma. This portrayal can influence policy and public opinion, further marginalizing affected individuals. Also, education system. Schools can perpetuate stigma by failing to adequately support students with mental health issues, contributing to their marginalization and dropout rates. So, what are the implications of defining mental illness as a form of deviance? So, defining mental illness as deviance can lead to policies and prioritize control and containment over treatment and support, such as increasing funding for psychiatric hospitals rather than community based care. Also, resources can be allocated based on this control over mental illnesses. Resources may be directed more towards law enforcement and criminal justice responses to mental illness rather than preventative and rehabilitative services. Viewing mental illness as deviance can undermine the human rights of affected individuals, leading to practices that violate their dignity and autonomy. As I mentioned in Foucault's writings on psychiatry, he talks about how people become as dehumanized. They don't have freedom. They can't do nothing because they are stigmatized or labeled by mental illness, and all the rights are taken away from them. So basically, they lost their human rights. Mental health care may become more punitive and less therapeutic, focusing on managing perceived deviance behavior rather than promoting recovery and well being. So, the stigma and social control is huge parts of mental health and deviance. How we can understand now that how mental illness can be a social construction that leads to social control. Both ways, people with mental illnesses have very hard time to become part of society. They are marginalized, they are isolated, they are going through a lot of hardships um, because of their situation. Now about cultural perceptions and mental treatment of mental illnesses. So the questions now we consider is how do different cultures perceive and treat mental illness, and what does this say about the concept of deviance? In what ways do cultural norms and values influence the classification and treatment of mental illness? So in Western cultures, we can think of medical models. Mental illness is primarily viewed through a biomedical lens, focusing on diagnosis and treatment with medicalization and psychotherapy. Despite medical advances, stigma persists, often leading to discrimination and social exclusion. There is a history of institutionalizing mentally ill individuals through recent trends emphasizing community based care and the institutionalization. On the other hand, Eastern cultures, there is more holistic approach. Mental illness is often understood in a holistic context, incorporating physical, emotional, and spiritual dimensions. Treatment may include traditional practices such as acupuncture, herbal medicine, meditation, alongside or instead of Western medical treatments. Family and community play very significant role in providing care, reflecting the collective approach to health and well-being. And if we think about the indigenous cultures, there is another way of viewing how different cultures treat mental illness. In indigenous cultures, it can be more towards like spiritual interpretation of the situation, or mental illness may be seen as a spiritual imbalance or a result of disharmony with nature and community. Healing often involves traditional rituals, spiritual ceremonies, and the involvement of community healers or shamans. Do you guys know what shamans means? So those people are more like a natural way of helping other people to find balance in life. There is a strong emphasis on reintegration into the community rather than isolation or institutionalization. Anyways, isolation and institutionalization are very bad practices when it comes to mental health, illness. In African cultures, it's a little bit different. There is also, it's a similar thing to indigenous cultures. There is a spiritual and supernatural beliefs in African cultures. Mental illness can be attributed to supernatural forces, like it was in 19th century Europe, right? Witchcraft or ancestral displeasures, right? Treatment often involves the extended family and community elders with a focus on restoring social harmony. Stigma can be also intense, leading to social exclusion and discrimination, although traditional support systems may mitigate some of these effects. So, what does it say about the concept of deviance? The perception of mental illness as deviance varies widely across cultures, reflecting different beliefs, values, and social norms. What is considered deviant in one culture may be seen as normal in another culture. The classification of mental illness as deviance highlights the role of social construction in defining abnormal behavior. Cultural context determines what behaviors are labeled as deviant and how they can be managed. Also, different cultural approaches to mental illness illustrate the adaptability and flexibility of concept of deviance. Cultures adapt their definitions and treatments based on historical, social, and environmental factors. So, in what ways the cultural norms and values influence the classification and treatment of mental illness? So, we have to define what is normalcy and deviance to answer that question. So, cultural norms dictate what is considered normal behavior, thus influencing which behaviors are labeled as deviant or indicative of mental illness. Also, social values such as individual, like for example in Western societies, we have this um, individualism, right? We are just focused on ourselves more. Or collectivism in Eastern cultures shape the understanding and response to mental illness. So there is different treatment modalities in different cultures. For example, in Western medicine, um, that Western medicine prioritize scientific and mental approaches, as I mentioned earlier, and the treatments focus on medicalization and psychotherapy. In traditional societies or traditional cultures, the value that value traditional knowledge and practices may rely on more community healers and spiritual rituals and natural remedies. Some cultures integrate both traditional and modern medical practices, reflecting a synthesis of cultural values and contemporary healthcare. When it comes to stigma and social response, cultural attitudes towards mental illness significantly impact the level of stigma and discrimination faced by individuals. Societies that view mental illness as moral failing or supernatural issue tend to have higher levels of stigma. And how about the support systems? Cultural values around family and community support influence the availability and nature of social support systems for individuals with mental illnesses. And also, there are different kind of policies and institutional frameworks that affect how we view mental illnesses and how we treat them. For example, some health policies, cultural norms, and values shape health policies and the allocation of resources for mental health care. If certain mental health is viewed as deviance, maybe then more resources are allocated towards law enforcement and criminalization and incarceration of mentally ill people, right? Cultures that prioritize mental health as public health issue tend to have more comprehensive mental health services. How about legal frameworks? Legal definitions of mental illness and policies regarding treatment and rights of individuals with mental illness are influenced by cultural values and societal norms. So, in summary, culture affects how we view mental illness and deviance. Western cultures focus on biomedical models, Eastern cultures adopt holistic approaches, indigenous cultures emphasize spiritual and community aspects, and African cultures incorporate spiritual and supernatural beliefs, as we mentioned earlier. These differences highlight the cultural relativity of deviance and social construction of mental illness. Cultural norms and values shape the definition, classification, and treatment of mental illness. Treatment modalities range from modern medicine to traditional healing practices reflecting cultural beliefs. Stigma, support systems, policies, and legal frameworks are all influenced by cultural um, attitudes towards mental illness and deviance. So the culture really influence our views on mental illness and deviance. Then how about intersectionality and social inequality? So what is intersectionality? That is a theory concept developed by Grimshaw. Intersectionality means that all individuals have different kinds of experience based on their gender, race, wealth, social status, education, and all these other factors. For example, um, Grimshaw argues that the experience of black men can be different than experience of black women. Experience of let's say wealthy black men can be different than poor black men's experience in society, right? Or if there is a gender or race or for example religion or age, those are all the factors makes difference in our lives. So how do race, gender, class, and other social identities intersect to influence the experience of mental illness as deviance? So let's take a look at this question. So racial minorities are often underdiagnosed or misdiagnosed due to cultural biases and lack of culturally competent care. Different cultural backgrounds influence how mental illness is perceived and treated, leading to varied experiences of deviance. And systemic racism also has a huge role in this. Historical and systemic racism contributes to higher stress levels and trauma among racial minorities, impacting mental health. And they maybe don't get quality quality treatment, or they are far from the institutions that can help them, right? Also, gender. Societal expectations about gender roles can affect the ex, um, expression and recognition of mental illness. For example, men might be less likely to seek help due to stigma around expressing vulnerability. Women, particularly those experiencing gender bias based violence, may have higher rates of certain mental health issues than men, influencing how they are perceived and treated. How about class, social class? So, socioeconomic status affects access to mental health, care, and resources. Lower income individuals may have limited access to quality care, leading to worse outcomes and increased labeling as deviance. Also, economic hardships as significant stressor that can exacerbate mental health issues, leading to higher rates of mental illness among lower socioeconomic groups. Other social identities, for example, sexual orientation, LGBTQ plus individuals face higher rates of mental health issues due to stigma, discrimination, lack of support, influencing their experience of mental illness as deviance. People with physical and cognitive disabilities may experience compounded stigma and marginalization, affecting their mental health and how it is perceived. So, in what ways do these intersections um, increase the stigmatization and marginalization of individuals with mental illnesses? So, compounded stigma. What is compounded stigma? So, there is multiple layers of stigma in society. Individuals with intersecting marginalized identities, for example, black women from low income background, face compounded stigma, where each identity contributes to greater overall stigmatization. So if you have so many things that is pulling you down, that means there is higher level of stigma you may experience. Also, access to care. Intersectionality can create additional barriers to accessing mental health care, such as language barriers and cultural insensitivity and economic constraints. Marginalized groups often receive lower quality of care due to biases in the healthcare system, reinforcing negative outcomes and stigmatization. Social support also can be different for those who are experiencing discrimination and stigma in society. Intersecting identities can lead to social isolation due to compounded stigma from different communities, reducing social support and increasing vulnerability. Different communities may respond to variables or different mental illnesses, with some being more supportive and others more stigmatizing, affecting individuals' experiences based on their intersecting identities. How about social inequality? How does socioeconomic stats impact the likelihood of being labeled as mentally ill and deviant? Well, when it comes to stress and mental health, lower socioeconomic status is associated with higher levels of chronic stress, which can lead to or increase mental health issues. Individuals from lower economic backgrounds may have limited access to mental health services, leading to untreated conditions and higher visibility of symptoms. Also, visibility and policing matters. Lower income individuals are more likely to be under surveillance by social services, law enforcement, and even psychiatry, increasing the likelihood of being labeled as deviant. And also, criminalization. Economically disadvantaged people often um, economically being disadvantaged often leads to criminalization of behavior associated with mental illness, reinforcing the label of deviance. Also, there is diagnostic biases. There may be biases in diagnosis mental health healthcare systems. Um, Also, with poor individuals more likely to be labeled as having severe mental disorders. Healthcare providers may unconsciously exhibit biases that lead to differential diagnosis and treatment based on the socioeconomic statuses. So, the last question: what are the social and economic consequences of this labeling for individuals from different socioeconomic backgrounds? My throat is hurting. So, employment and income can be one of those. Being labeled as mentally ill can lead to job loss or difficulty finding employment, exacerbating economic instability. And also, income reduction is another thing can happen. Stigmatization and discrimination in the workplace can result in lower wages and fewer opportunities for advancement and promotion. Social mobility. Labeling can create barriers to social mobility, trapping individuals in lower socioeconomic strata. Children from lower income families labeled with mental illness may face discrimination in educational settings, limiting their future opportunities. And this will lead to a cycle of poverty. Limited access to mental health care can perpetuate a cycle of poverty where untreated mental health issues prevent economic advancement, or those people can't get promoted, can't get better jobs, can't get better payments. So they will struggle even more with their status, which increases stress. When stress is increased, mental illness gets worse, right? So that also can lead to isolation from other members of society. The stigma of mental illness can lead to social isolation, reducing support networks crucial for coping with socioeconomic challenges. Also, labeling can result in exclusion from community activities and support systems, further marginalizing those individuals. So, in short, or as summary, race, gender, class, other identities intersect to create unique experiences of mental illness and deviance. These intersections exacerbate stigmatization and marginalization through compounded stigma, barriers to care, and reduced social support. And social inequality. Socioeconomic status significantly impacts the likelihood of being labeled as mentally ill and deviant, influencing by socioeconomic stress, access to services, and healthcare biases. The consequences of labeling include reducing employment opportunities or limiting social mobility, barriers to healthcare access, and social um, increased social isolation. So there are higher rates of being diagnosed or labeled by mental illnesses based on race. There is article you have that is race and psychiatry: what's wrong with poor and racial minorities, and we can read that and understand that higher levels of anxiety, stress related illnesses increase when people are going through hard times. There is a higher risk of depression because they have more stress in their lives. Maybe they're struggling with discrimination, they are struggling with stigma, they're struggling with their socioeconomic status and low income. They feel helpless, hopeless, they feel fear, mistreatment, despair, alienation, and all of these kinds of feelings. Also, they may experience damaged self esteem, higher risk of addiction and violence. So, when the addiction and violence comes to picture, people experience more stress, more depression, right? And less access to mental health care, quality of services, all of them comes in one package. And now that helps us understand why there are more people who are stigmatized as deviant and mental illness in certain society, certain communities, or certain individuals. Policy and advocacy. So that is another very important area to talk about when it comes to mental illnesses and deviance. So, what are the implications of viewing mental illness as deviance for mental health policies and practices? So, we can think of criminalization of mental illnesses. Viewing mental illness as deviance often results in the criminalization of individuals with mental health issues, leading to increased interaction with criminal justice system rather than healthcare services. They are already going through a hard time, and we increase their anxieties, we increase their stress by throwing them into this criminal justice system. Many individuals with mental illness are incarcerated instead of receiving appropriate medical treatment, exacerbating their conditions and leading to um, leading to even more mental illnesses. Stigmatization in the healthcare system is another issue. Mental health policies may be influenced by stigmatizing views, resulting biased treatments, lower quality of care for those labeled as deviants, and policies may not prioritize mental health care limiting funding and resources for mental health services, which disproportionately affects those most in need. Resource allocation is the very huge part of this all. Viewing mental illness as deviance can lead to insufficient funding for mental health services as resources are diverted to law enforcement and punitive systems. There may be lack of focus on preventative care and early intervention. That can also lead to more severe mental health issues that are harder to treat. So, then, how can public policy shift to reduce the stigmatization of mental illness and improve outcomes for those affected? Decriminalization can be one of them. Implementing policies that decriminalize behaviors associated with mental illness or stigma and divert individuals to appropriate mental health care rather than criminal justice system. Expanding mental health courts that focus on treatment and rehabilitation rather than punishment can also be effective way of dealing with that. Increasing public awareness, launching public education campaigns to increase awareness and understanding of mental health issues, aiming to reduce stigma and promote acceptance, also helps with this kind of changes. In media representation, encouraging positive and accurate portrayals of mental illness in the media can challenge stereotypes and misinformation. Um, then, what role can advocacy groups play in changing societal perceptions of mental illness and deviance? So, I think the main thing we can think of is increasing awareness and education. Advocacy groups can run campaigns to educate public about mental illnesses, emphasizing that mental illness is not a form of deviance, but a medical condition that should be treated or cared for. Providing workshops and training sessions for, let's say, educators, employers, community leaders to foster inclusive and supportive environments can also increase awareness towards mental illnesses and how we can help them. And policy advocacy, lobbying for policy. These days people can influence policy by lobbying, right? So, lobbying for policy changes that promote mental health awareness, protect the rights of individuals with mental illnesses, and ensuring adequate funding for mental health care services can be one of the things we can do to improve policy and advocacy. Collaborating with other organizations, like many organizations becoming together or uniting, including healthcare providers, educational institutions, or government agencies, to advocate for comprehensive mental health policies can be one of the best things we can do. So, how can mental health care system be reinforced to address the needs of those labeled as deviant due to mental illness? Good question. So, um, developing maybe developing holistic approaches can be one of the things. Developing integrated care models that address both physical and mental health needs, recognizing the interconnectedness of overall well being can really help understanding the mental illnesses and human condition. And also, we can think of culturally competent care, training healthcare providers in cultural competence to ensure they can effectively serve diverse populations, and reduce biases in diagnosis and treatment. Probably one of the important things we have to do. Ensuring mental health services are accessible to all individuals. They are regardless of their race, gender, how much income they have, and their socioeconomic status, regardless of their anything. By providing affordable or free services, we can also reduce the stigmatization of mental illnesses. Expanding telehealth options to reach individuals in remote or underserved areas. Actually, after the COVID-19, certain kind of medical services became like a Zoom based or video based or something like that. You don't have to just travel to go and see a doctor. You can just book an appointment and talk to your doctor through Zoom or something. And this kind of stuff can be done also people who live away from big cities, right? Also, community-based programs can help, like supportive housing and employment programs, creating employment programs that offer job training and placement services for individuals with mental health issues, promoting that can promote economic stability and social integration. In summary, policy implications. Viewing mental illness as deviance leads to criminalization, stigmatization in healthcare, and insufficient resource allocation. Public policy can shift by decriminalizing mental illness, raising awareness, providing comprehensive mental health services, and enacting anti discriminatory laws. Advocacy and reform. So, when we intend to summarize the points we made in advocacy and reform, we have to think about um, how crucial role these groups play in changing societal perceptions through education, policy, advocacy, and support networks. Mental health care can be reinforced by promoting integrated care, ensuring accessibility, implementing early intervention, and expanding community based programs. So, there are differences between um, experience in personal levels and societal impact. How individuals labeled as mentally ill perceived their own experience of deviance and stigma. So, individuals labeled as mentally ill often perceive their experience of deviance and stigma as deeply impacted on their sense of self and social interactions. The stigma attached to mental illness can lead to feelings of shame, isolation, and a diminished sense of worth. Many reports that societal reactions to their conditions exacerbate their struggles, leading to cycle where the stigma itself becomes a significant barrier to recovery and social integration. This experience are influenced by cultural context with variations in low stigma in manifested and perceived across different societies. So, what are the psychological impacts of being labeled as deviant on individuals with mental illnesses? So, being labeled as deviant due to mental illness can have profound psychological impacts, including increased stress, anxiety, and depression. The internalization of negative stereotypes and societal rejection can lead to lower self esteem and self efficacy. Individuals may also experience heightened fear of social interactions and potential discrimination, further contributes to their feelings of loneliness and alienation. How does the perception of mental illness as deviance affect society as a whole, particularly in terms of social cohesion and public health? Now, when we talk about macro and micro, in our first class, I said that macro levels are like more societal levels or huge group levels or cultural levels, right? Micro levels or more individual levels. Now, societal impact is very important. The perception of mental illness as deviance can weaken social cohesion or unity by promoting exclusion and discrimination against individuals with mental health conditions. This marginalization can lead to fragmented society where a significant portion of the population is prevented from fully participating in social, economic, and cultural activities. Additionally, viewing mental illness through a lens of deviance can deter individuals from seeking help, um, exacerbating public health issues by increased untreated mental health problems. Addressing these perceptions can improve societal well being and foster more inclusive community. So, what are the broader societal benefits of shifting the narrative away from mental illness as deviance to a more inclusive and supportive understanding? So, shifting the narrative away from viewing mental illness as deviance to more inclusive and supportive understanding can yield several societal benefits. It can reduce stigma. It can encourage more individuals to seek treatment and support. This shift can enhance social integration, allowing people with mental health issues to contribute more effectively in society. Moreover, fostering a supportive environment can lead to better mental health um, outcomes. Promoting understanding and empathy towards mental illness can strengthen community bonds and create healthier, more resilient society. If there's support, people starts to feel better about themselves. So there is all different kinds of things happening in this area. So our experiences of mental illness as abnormal, deviant, so contributes to stigmatization and contributes to labeling other people. So understanding and education can help us um, bounce back and bring these people to integrate back to society. So I mentioned in a couple places about Michel Foucault. I would like to introduce some of his concepts. Michel Foucault was born in 1926 and died in 1984. His parents wanted him to study medicine, but he loved philosophy. So Foucault was a gay person, and he went through a lot of hardships because in his time that being gay was being deviant, and society would not accept them, especially his parents were kind of like ashamed of that, and then they put him through psychiatrist's supervision, which tormented him. He went through a lot of hardships growing up. Psychiatric hospital traumatized Foucault, but psychology fascinated him. When he was being treated as mentally ill person, he was traumatized by psychiatric hospital, but psychology itself was fascinating for him. So he found that interest that brightened his work, and he wrote amazing books because of his experiences with mental illnesses. He was diagnosed with mental illness. In that time, homosexuality was diagnosed mental illness until 1986. So he was diagnosed with mentally ill for homosexuality and depression, and psychiatrists can legally take away the rights of the patient. That's what he writes about. He says there is no right to vote, travel, get a lawyer, and the people who are um, diagnosed with mental illnesses, they lose all of their rights to the human rights, actually. Once diagnosed, psychiatrists can arrest them, hospitalize them, and inject brain suppressing medications against the patient's will. They can do all different kinds of stuff. Those medications have very dire side effects that can even cause death, coma, brain damage, and all of those stuff. So he experienced those kind of things. So he writes about psychiatry, his most urgent task to change our concept of power. He says, our main urgent task is to change our concept of power, repressive and normalizing power. That power is not limited to government, he says. And the power is also in psychiatry. Power is not limited to institutions like police or army. Institutional authorities transmit orders and punish those who don't obey. However, psychiatry also exercises political power. So some people, for example, political dissent or people who were opposition to certain parties also were criminalized, and some of them were actually um, diagnosed with mental illnesses and locked this psychiatric hospitals. He says it seems psychiatry is independent from politics, like it is trying to help patients, but it enacts political power for some social classes upon others. He says psychiatry enacts political violence, masks as scientific neutrality and independence. So, overall, that Foucault's views on psychiatry is very, very negative. You can tell by how he explains that the mental illnesses are similar to incarcerating individuals. There is one in five in Canada experience mental health issues. 40% of contact with mentally ill people is non-criminal, so they are not criminals. Some of the sent to forensic psychiatric centers, what do they need? They need secure housing, structure, and meaningful activities, employment, engagement. To help people with mental illnesses, we need to bring them back to community so they don't feel isolated, they don't feel lonely, they don't feel they have nothing to do, they don't feel like their life is purposeless, right? So, institutionalization and deinstitutionalization of mental illness are two contrasting approaches to the care and treatment of individuals' mental health conditions. Institutionalization argument tells that these people, mentally ill people, can be dangerous for society, so they need to be put away so the rest of the society is safe. deinstitutionalization model says that no, these people are not criminals. They need to be in their communities. Those they can heal. They can have full life by being with their loved ones. So that is end of our lecture for today. So in today's lecture, we talked about mental illness and deviance, how mental illness considered as deviant in society. We talked about theories of mental illness and deviance, how theories explain these situations. And we talked about intersectionality, we talked about labeling, stigmatization, we talked about different experiences in macro and micro levels, and also we generally in the surface level talked about Foucault's experience with mental illness, and that he ended up with writing about psychiatry and paying so much attention on mental illnesses. So this is our today's lecture, and thank you for your time. I will talk to you again in our next class.